Hi everyone, welcome back to our channel. Today we will discuss about the most important MCQ for the mental status examination and mini mental status examination for the nursing exam point of view. It is a important topic for the psychiatric. First question. The primary purpose of a mental status examination is to option A diagnose medical conditions, option B assess a patient's cognitive, emotional and behavioral functioning, option C prescribe medications, option D perform surgery. The answer is option B assess a patient cognitive, emotional and behavioral functioning. MSE mental status examination is a structured assessment of mental functioning used to detect any psychiatric disorder and monitor the changes of the person. Next, which of the following is a component of the MSE mental status examination? Option A appearance, speech, mood, thought process, cognition. Option B height and weight only. Option C heart rate and BP only. Option D dietary habits exclusive. The answer is option A appearance, speech, mood, thought process and cognition. MSE mental status examination evaluates the appearance, behavior, speech, mood, thoughts and perception, cognitions, insight and the judgment also. Next, the MMSE mini mental status examination is primarily used to option A assess the nutritional status, option B screen for the cognitive impairment, option C diagnose the depression, option D evaluate the cardiovascular health. The answer is option B screen for the cognitive impairment. Mini mental status examination is a brief cognitive screening tool to detecting the dementia, delirium or the any other disorder. Next, which MMSE mini mental status examination score typically indicates the normal cognition? Option A 30 between 27 to 30, option B 26 to 24, option C 23 to 18, option D less than 70. The answer is option A 30 to 27. The score generally 27 to 30 reflect the normal cognition function. Lower score suggests the mild to severe impairment. So the answer is option A. Next, a patient score 20 on the mini mental status examination. This indicates option A normal cognition, option B mild cognitive impairment, option C moderate cognitive impairment, option D severe cognitive impairment. The answer is option C. The answer is option C 30 to 27 is the normal score. If it decrease the step by step, it will 23 to 20 is mild, moderate 20 to 10 to 20, 10 to 20 score is known as the moderate cognitive. So its option C is the correct answer. Next, during the mental status examination, assessing thoughts content involves in the option A evaluating memory, option B evaluating the delusions, obsession and the suicidal thoughts, option C checking the vital signs, option D observing the gait. The answer is option B evaluating the delusions, obsession and the suicidal thoughts. Next, which domain of MSE mental status examination assess the orientation to time, place and the person. Option A, cognition. Option B, perception. Option C, insight. Option D, effect. The answer is option A, cognition, because orientation is a key component of the cognitive assessment. So answer is option A. Next, during mental status examination, the nurse observes a patient's speech is rapid, pressured, and the deficit to the interrupt. This reflects is option A, dysarthria. Option B, thought disorder. Option C, mania. Option D, depression. The answer is mania. Pressured speech is a common feature in the manic episode. So answer is option C. Next, which of the following is assessed under appearance and behavior in MSE, mental status examination? Option A, grooming, posture, eye contact. Option B, blood pressure. Option C, heart sound. Option D, reflexes. The answer is option A, grooming, posture and eye contact. Appearance and the behavior provide the insight into self-care, affect and the social engagement. So the answer is option A. Next, the mini mental status evaluates which cognitive domains? Option A, orientation. Option registration, attention, recall, language, visuospatial skills. Option B, nutrition only. Option C, blood sugar level. Option D, cardiac function. The answer is option A, orientation, registration, attention, recall and language, because MMSE, mini mental status examination, is designed to cover the key cognitive domains for the quick assessment. Next, a patient reports hearing voices that are not present. This is an abnormality of option A, thought process. Option B, perception. Option C, cognition. Option D, mood. The answer is option B, perception, because hallucination represent the abnormal sensory perceptions. Next, the nurse asks the patient to spell word backward to assess the attention. This is a part of option A, memory. Option B, attention and concentration. Option C, mood assessment. Option D, insight. The answer is option B, attention and the concentration, because serial or backward spelling tasks test attention and the concentration in the mini mental status examination. So answer is option B. Next, immediate recall during mini mental status examination test is a short-term memory. Option B, long-term memory. Option C, abstract thinking. Option D, insight. The answer is option A, short-term memory, because immediate recall evaluates the ability to retain new information briefly. So the answer is option A. Next, a patient's affects is flat and unresponsive. This is observed under the option A, mood and effects. Option B, cognition. Option C, perception. Option D, speech. The answer is option A, mood and effect, because after refers to the observable expression of the emotion. Next, insight in mental status examination referred to option A, ability to judge on self. Option B, awareness of own illness and need for the treatment. Option C, eye contact. Option D, memory performance. The answer is option B, awareness of own illness and need for the treatment is the inside a patient understanding of their psychiatric condition. Next, judgment assessment in mental status examination involves option A, asking how the patient would handle hypothetical situation. Option B, measuring the BP. Option C, observing posture only. Option D, administering mini mental status examination. The answer is option A, asking how the patient would handle hypothetical situation. Next, a patient score 15 on mini mental status examination. Now that should option A, reassure normal cognition. Option B, document moderate cognitive impairment. Option C, encourage mini mental status examination retest next year. Option C, D, refer for the nutritional counseling only. The answer is option B, because we already discussed about that moderate score of mini mental status examination is 10 to 20. So the answer will be option B, document moderate cognitive impairment. Next, thought process in mental status examination refers to option A, how thoughts are formed and expressed. Option B, content of thoughts. Option C, mood. Option D, cognition. The answer is option A, how thoughts are formed and expressed. Option B, content of thoughts. Option C, mood. Option D, cognition. The answer is option A, how thoughts are formed and expressed, because thought process evaluates the coherence, logic and flow of thinking. So the answer will be option A. Next, which mental status examination finding suggests depression? Option A, pressure speech. Option B, psychomotor retardation and flat affect. Option C, grandiose delusions. Option D, hallucination. The answer is option B, because slowed movements and the restricted effect are common in the difference. When a patient is in the depression, they will do the slowly work and they will movement very slowly. Next, orientation to place is tested by asking what. Option A, what city are we in? Option B, what is your mother's maiden name? Option C, spell world backward. Option D, recall 3 objects. The answer is option A, what city are we in, because orientation question assess the awareness of the environment. Next, remote memory in mental status examination includes option A, recent events. Option B, distant personal history like birthplace. Option C, counting backward. Option D, immediate recall of words. The answer is option B, distant personal history like the birthplace, because remote memory evaluates the long-term stored information. Next, calculation ability in mental status examination is tested by option A, counting backward by the sevens from the 100. Option B, naming the objects. Option C, writing a sentence. Option D, reciting a poem. The answer is option B. Option A, counting backward by the 7th from 100, because serial 7s test attention, concentration and the calculation. Next, A patient demonstrates E. coli. This is assessed under the speech and the language. Option B, mood. Option C, cognition. Option D, perception. The answer is option A, speech and the language. Echolalia is a repetition of another's words indicating speech or language distribution. Echolalia means when you are asking a patient what is your name, they will also tell that what is your name. This is the repetition of the word. This is known as the echolalia. Next, a mini mental status examinations question. Show me a pencil and watch evaluates. Option A, attention. Option B, language and the comprehensions. Option C, memory. Option D, insight. The answer is option B, language and the comprehensions, because command of following assess the comprehension and the language function. Next, in mini mental status examination, drawing intersecting pentozones assess. Option A, attention. Option B, visuospatial ability. Option C, memory. Option D, language. The answer is option B, visuospatial ability, because the copying figures tests the visuospatial and constructional skill. So the answer will be option B. Next, a patient with the disorganized speech exhibits. Option A, tangentiality or the loss of association. Option B, normal thoughts. Option C, only mood disturbance. Option D, memory deficit exclusively. The answer is option A, tangentiality or loss of association, because thought disorder is evident in disorganized speech pattern. So the answer will be option A. Next, which mental status examination findings is characteristics of mania? Option A, slow speech. Option B, pressured or rapid speech. Option C, flat effect. Option D, memory loss. The answer is option B, pressured and rapid speech, because mania often presents with the rapid or the difficulty to interrupt speech. So the answer is option B. Next, during the mini mental status examination, asking a patient to name the object test. Option A, this is known as attention. Option B, language. Option C, memory. Option D, insight. The answer is option B, language. Object naming evaluates the expressive language skill. Next, which cognitive domain is not assessed in the mini mental status examination? Option A, orientation. Option B, attention. Option C, personality. Option D, memory. The answer is option C, personality. Mini mental status examination focuses on the cognitive function, not the personality traits. Next, the nurse observes a patient laughing inappropriately. This is assessed under option A, affect. Option B, cognition. Option C, thought content. Option D, perception. The answer is option A, affect, because affect assessment identifies the congruence with the mood and the social appropriateness. Next, a patient shows poor judgment by giving money to stranger. This reflects option A, insight. Option B, judgment. Option C, memory. Option D, orientation. The answer is option B, judgment. Because judgment is assessed by ability to make the reasonable decision. Next, during mini mental status examination, repeating the first no, ifs, ands, or buts test. Option A memory, option B language and attention, option C visuospatial, option D orientation. The answer is option B language and the attention. Because repetition tasks assess the verbal expression and attentional focus. So the answer is option B. Next, which mental status domain includes the hallucination and the illusion? Option A perception, option B cognition, option C mood, option D insight. The answer is option A perception, because abnormal sensory experiences are evaluated under the perception. Next, the nurse observes the patient pacing constantly. This is recorded under the option A appearance and the behavior, option B cognition, option C thought content, option D effect. The answer is option A appearance and the behavior, because activity level and motor behavior are the part of the behavioral assessment. Next, a mini mental status examination attention test can include option A serial sevens, option B naming objects, option C orientation question, option D copying a drawing. The answer is option A serial sevens, because serial subtraction test attention and the concentration. So the answer will be option A. Next, short-term memory in mini mental status examination is tested by option A recall of 3 objects after a few minutes, option B name of the birthplace, option C counting backward by sevens, option D coping pentagons. The answer is option A recall of 3 objects after a few minutes. Delayed recall measures the short-term memory retention. Next, a patient demonstrates thought blocking. This is option A sudden interruption of the speech or the thought, option B slow movement, option C visual hallucination, option D normal finding. The answer is option A sudden interruption of the speech or the thought. Next, in mini mental status examination, writing a sentence assess option A language and the prefix, option B memory, option C attention, option D orientation. The answer is option A language and the prefix, because writing evaluates the expressive language, grammar and the motor coordination. So the answer will be option A. Next, a patient says, I am the king of the world. This is an abnormality of option A thought content, option B mood, option C cognition, option D speech. The answer is option A thought content, because grandiose delusion reflect the abnormal beliefs within the thoughts or content. When they will think like that, sometimes they will think that they are the god and they are the Salman Khan, like Shah Rukh Khan's, everything they will can thought. Next, which statement is correct about the mental status examination and mini mental status examination? Option A mental status examination is brief, mini mental status examination is detailed. Option B, mental status examination is comprehensive. Mini mental status is a screening tool. Option C, both assess personality only. Option D, both replaces the psychiatric diagnosis. The answer is option B. Mental status is a comprehensive and mini mental status is a screening tool. Thank you everyone. Please like, share and subscribe our channel. Like, share and subscribe our channel. And in which topic you want the video, please comment. We will try to make the video. Thank you everyone.